has 3,000 3,900 in 2022, and this number is five highest in the world, and we're five highest in the world, and we're just better than Zimbabwe. Imagine uh we're still a step better than African country. So yeah.
Kelihatan apa?
Yes.
Ya.
But I still remember about the topic, but still, first,
Naik aja. Lagi lagi deh. Tapi jangan berisik. Ya.
personally, um, uh, I'm looking at the what's it? What on the side?
Yeah.
Yeah. So I'm looking. Oh.
Mari. Itu ya dan
Yeah, that big number is also shocking. No, I'm actually taking the data from we're all meters. We're all meters. It's a website that our world in data. it is kind of site that compile every cases through the latest report. So kind of like a daily report and sort of. And then we're gonna take a look at trends of incidence rate in Indonesia. So in we can take from this display in to 2019 to 2020. There are already the decrease in number and also in 2021, but it's suddenly increased in 2022, and this makes me interested in to take a deep look into this topic. Also in Sumatra and Padang, there are also similar pattern to Indonesia trend. But first, we're gonna take a look at our condition in Padang. So in Padang, there are 140 villages with 11 sub-districts, and it covers area of 695 kilometers square, and with average temperature of 27.2 degrees Celsius, relative humidity at 83.75%, air pressure at 1010 millibar, wind speed at around 1 knot, precipitation, rate of precipitation 6.65 millimeter cubic, duration of sunshine 5.25 hours, and immigration or people moving coming into the city at 1,490 490 and outmigration at 1,570. So before we take a deep we dive into the topic, we're gonna take a look at what's the background of this study. So there are these studies. Well, first about temperature. For the measles virus, if the ideal temperature is range from 15 to 56 degrees Celsius, and few studies contradict each other's in its association with the measles incidence. Also for humidity, as we can see right here. Next, about the air pressure. So as we know that in infectious disease, the health professional often put the patient into the negative pressure room to limit the spread of the virus. So air pressure could be relevant into with this topic. Also with speed, as we know, the measles virus is one kind of airborne virus. So the wind speed could also associated with measles incident. Next about precipitation. Precipitation, what? Precipitation. Then duration of sunshine. As we so I found that measles virus, if exposed with sunshine around 30 minutes, it could inactivate the virus. And this about the population mobility. So population as the CDC and WHO suggest that if you travel into the measles endemic area without any precaution, like taking measles shot, it would likely increase the chance of contracting measles. So the after all the backgrounds before, we have problem formulation of uh, uh, we we have the problem formulation of the association between climatic factor and population mobility with incidence measles incidence in Padang. So the purpose of the research, as we can see right here, to find the frequency distribution, the association, the most dominant variable, the multivariate analysis, then showing the temporal trend, and also mapping the measles incidence. And this is the benefit of the research. It could be the materials community regulations to mitigate measles and also to shine light on measles issues that are often neglected in this society. This is about the research and further the researchers going to conduct the divariate and multivariate analysis using processing applications on computer device. So as I have stated before, this method has etiology. And for the epidemiology, professor, we're focused in three aspects. It's about people, place, and time. People, the most vulnerable group is the children, and the the and the case is more the cases are more often happen in low income country, third world country, such as in Africa and in Southeast Asia. It's still common disease, and for the time it also found that the it started the outbreak started when when there's a transitional season, a transitional phase of season from dry to rainy, because when the transitional phase, our body keep up with it, and our immune system is weakened when in transitional phase. So we're prone to get infected with measles. And for the stages, it's from Acarol, prodromal, and convalescent. Acarol, when you're having fever. Prodromal, when you're having red rash in your body. And then last, convalescence, when it leaves dark spots on your body. This for treatment and prevention. For treatment, we are focusing in easing the patient and also treating the disease. And for prevention, there are primary, secondary, and tertiary vaccination, identification, and prevention from further damage. So this is the definition of each variables from temperature, humidity, air pressure, wind speed, precipitation, duration of sunshine, in-migration, and out-migration. Ladies and gentlemen, this is a literature review. Is the core of our research. Several studies. We're going to fast forward into the differentiation from previous research. The interesting thing in this research, the interesting that I found this research is that I haven't found the other previous research that specifically talk about the association between the population mobility and measles incidence. Even though the WHO and CDC are already suggested that you have to take precautions before going to endemic measles region to prevent you from getting contracting measles. That is the theoretical framework. Sorry, because it's still in Indonesia, but I will translate this host agent environment as I stated before. The host, their age, then nutrition status, uh, measles immunization status, the UCI, then population mobility, um, uh, knowledge and attitude of the mother, then knowledge and attitude of the health professionals. In the environment, there are the variables before, like temperature, relative humidity, and also ventilation, and density, and agent is morbidly virus. And this is the concept of the other variable that I will analyze later. So this is the hypothesis. All the variables are associated with the incidence, and then in the research we're gonna take a really close look into this topic. And for the research method, we're I'm using ecological study, quantitative study, specifically ecological study, the research study is from March to May and takes place in Padang with a sample of 324 cases of lethal incidents. And the studies conducted through document observation. So this using secondary data. Next is the start daily processing the data, editing, cleaning, processing, and entering data. And for the analysis, I'm going to conduct three stages of data analysis from the variant. In the variant, we're going to take a look at the frequency distribution of this frequency distribution of each variable. Then in the variant, we're using the correlation, Pearson correlation for the exact, for the specific, and for multivariate, we're conduct the linear regression to determine what is the most dominant factors that associated with disability. And for disseminations, this study will produce graphs and tables that will show, that will present the on recent cases, climatic event, as well as probability. And also, there will be graph that presents the cash trend of measles for the last 4 years, and case map the 1 year. And this is the reference that I'm using in this study. And for the data that you have asked before, I found the data. Yeah, and the website. Yeah, this this one the website is it is providing daily report of cases around the world. So it's a real time report. Yeah, real time report. There are a few references. That's all from me. I'm sorry for the many inconvenience that happened before. That's all.
Thank you, Andi. Interesting presentation. It is research protocol, isn't it?
Yeah.
And so, to the audience, we can talk about it later. But now we move to the last presenters from our student. If the, I would like to present Mr. Rico Azrelina. 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 Sorry, Mr. Rico is coming again. So the presentation is about the risk factor or outbreak of avian influenza in Indonesia. It is a systematic review. So, Mr. Rico, for Mr. Rico, time is yours.
Your friends, all the lectures, our best lecture, Madam here in the Viva, PhD, I'm sorry, United States, welcome for names. Okay, in these occasions, I will share a bit information about risk factor for outbreak of avian influenza in Indonesia. First of all, I would like to introduce myself. My name is Rico Adrena. I am a veterinarian. Now I work for West Sumatra Livestock Services of the government of West Sumatra. This is the title of bit information about my presentations. Risk factor of outbreak avian influenza in Indonesia. I'm sorry if I said improper in English, but I tried that. Okay. This is the background SPC. Avian influenza is a contagious viral disease caused by a virus of the myxoviridae family. It or the disease will affect both domestic and wild birds. Viruses divide into multiple subtypes uh, like H5N1, H5N3, H5N8, and etc., whose genetic characteristic rapidly evolve against this rapidly change uh, kind of zoonotic disease. It can affect a human as well or other mammals. One of the major concerns of public health. Until 2020 and 2023, we had 168 human deaths caused by avian influenza in Indonesia. Avian influenza virus can circulate in poultry. For the case of avian influenza in human are sometimes identified. Will spread through the direct contact with secretion from infected birds, especially through faces or through contaminated feed and water. Because of the resistant nature of avian influenza virus, including their ability to survive for long periods when the temperatures are low, they can also be carried on farm equipment such like feeding equipments and spread easily from farm to farm. So here as human can brings the virus as well as during visiting the farms. Because the virus is very small size, we don't know we carry the virus as well. Generally, we classify into two categories according to the severity of the disease in poultry. Actually, we have two kinds. We say LPAI or HPAI. L for the low pathogenicity avian influenza that's typically cause little or no clinical signs. And the high pathogenicity avian influenza that's cause severe clinical signs and possible high mortality rates in domestic or commercial farms.
This is the methods. Actually, I forgot to edit this one. Actually, we have more than 100. I found more than hundreds journals for the avian influenza. The keyword is avian influenza full text in Bahasa or in English and free as well, and risk factor for risk factor of avian influenza and outbreaks avian influenza in Indonesia. Here is we have a timeline of avian influenza virus outbreak in Indonesia. First case happened in 2003, outbreaks in Java, and then will spread rapidly to all the province in Indonesia. And then first the human report in 2005, and then we found several claims for of avian influenza in Indonesia, and the others, the second outbreaks happened in 2012 until the 2016. Actually, in our province, it's West Sumatra, until 2022, we have no case report, but last years we have several cases sporadically happened in several districts in our province. And the rate of 2022, we found a new clade of avian influenza already detected in South Borneo province. Until now, we have, we already tried to do some surveillance and monitoring to our local or our local farms and backyard in several districts in our province, but we have no information about the new clade. I guess we have the clade is will not found in our province because it's really rapidly contagious due to birth of the poultry. And this is the risk factor for outbreak of avian influenza in Indonesia. We have four, I found four poultry outbreaks and growth density, human movement, wild and migratory birds, and rest, I mean, vehicle, pond, and wetland. The first is poultry density and growth density. You have tendencies when the poultry outbreaks occurred, there was a tendency to have human case as well for avian influenza outbreaks. Growth density contribute to the spread of maintenance of the high pathogenic avian influenza. The transportations in this province is very important for distributing manufactured products and raw materials to other regions in the country are the very isolated area. I mean the products like meat, egg, or another product from the poultry. Growth density is a reflector of the virus spread through the transportation of infected live poultry products, and others infected material. During the transportations, the birds are caged in poor biosecurity condition. Maybe you will see during the maybe your tourings or road trips to your hometown, we could see the like car having cage with 150 birds in the cage in the backside of the car. And then second is human activity and movement. Maybe you have the maybe you catch some things or you have like birds or chickens traditionals in your backyards and you might visit the owner house that have birds as well. We don't know that the conditions of our birds or the chickens is every house because the influenza have two types like I said before like low and high pathogenicity. So the visitor may have contacted with the other birds and contaminated soil is primary mode of transmission of many infection agents. The independent farms, I mean that traditional or self-owned farm deliver their products to the various aggregator. In Indonesia, we call like pengepul. Maybe in Indonesia we call it pengepul. So the aggregators move from the one farm to the others to collect the chickens or the egg. So the movement will increasing the risk to event influenza entry the poultry. And that human activity might have play a role through the higher risk for transmissions in more densely populated areas where poultry-related trade and traffic are more intensive. This is the illustrations like I said before. So the backyard systems or backyard poultry doesn't have good biosecurity like a commercial farm. The minimum biosecurity is like food dip that's content of disinfectants. So before we enter the poultry, we might dip our food to the deep foods. And this is the wild birds at backyard farm. So the wild birds, including the waterfalls, shorebirds, keepers are the primary of the primordial reservoir cause of the greatest genetic and anti-genetic diversity of influenza A viruses. Wild birds are capable of expressing abundant virus exams, in their patients before and after the onset of clinical signs or even asymptomatically. So the wild birds maybe have avian influenza in their body, but sometimes not show the symptoms of avian influenza. So the pathogenicity of these viruses has been variable in domestic and wild waterfalls as well in some terrestrial species. There's evidence of sometimes we have there's an evidence of neurological damage, efficient application in the trachea and brainers tissue, tropism in some bird species like ducks and terrestrial birds. That have been experimentally effective with H5N1 high pathogenicity avian influenza strain. So the two most important group of viruses is ortho-ancillary forms like duck, geese, and swans, and the other Sarah-Lee forms like swordfish and gulls in influenza transmission and spread. This is the illustration. So we have three parts: wildlife, agriculture, and humans. Ours. First, the first of is wildlife. So, like we see, every wildlife maintenance the diverse strains of the avian influenza, so they will transmit to the agriculture. Like we have previous case that poultry get the avian influenza case from the white birds that came to the poultry who doesn't have it's I can call it cage, high cage. So it's in fact all the poultry and in agriculture sporadic disease and mortality could be high or in medium stage. Sometimes the virus will adaptation and maintenance the virus happen and the virus could be spillover via the feces or vomit and contaminated feed and water. Why we have pig or swine pictures in the agriculture sometimes like the the virus in the swine body could be happen for reassortment and that's the from the agriculture that avian influenza virus could in fact the human through the exposure in wet markets and then exposure via animal husbandry. So that's why we got a zoonotic spillover. And this is the last peripheral pond and wetland. Wetland provide a critical habitat for waterfowl as well as the ecosystem services such as sediment trapping, groundwater purification, and water velocity reduction during flood. Yet, over the last several centuries, a third of all the wetlands have been drained, and used for development, agriculture, golf course, and domestic water use. Land use change that leads to higher waterfall density, so they doesn't have place to farm the food or stay during the migratory stress or proximity to domestic birds will likely lead to the increase the influenza transmission within flock and increase cross species transmission like from the uh, birds to the mammals. Wetland without protection areas may act as a reservoir from which the virus can spread into distant aquatic duck farm and terrestrial chicken farm. This kind of type of wetland. So the wetland and the pit, these wetlands and pit in the playing field are also attractive to migratory waterfowl and great meeting point for wild and domestic aquatic bird species. So the coexistence of free-grazing ducks and waterfowl during a wide period of the years, maybe November to February, may have provide an entry point or an index case for high pathogenicity avian influenza in proximity population. So maybe in our hometown, you could see the after the crops. So many farmers will gather all their ducks in the paddy field to get food for their ducks. This is the last against live porcine market of live bird markets or in Indonesia we call it pasar burung or maybe yeah bird markets. And it was environmental aspects of live bird market are needed for an influenza control program for two reasons. Because this is one of the important things to the transmission of avian influenza. First, a contaminated environment can provide a great source of virus transmission in which healthy birds coming into the market may become infected and person working in or visiting the market may also expose. That's why the spillover could be happen in live bird market. Second, ongoing surveillance program in LPM based on environmental safety are more likely than those based on invasive bird testing to be acceptable to traders and stall vendors. So we could maybe for the futures we might view the or we can concern to take the samples for the traders and stall vendors not only from the chickens or duck that's who sold in the market. Environmental scientific is also safer for public health officer and veterinary health officer that handling and accepting less person may be infected with avian influenza virus. This is the illustrations, like we say. So the aggregators will bring the ducks or the chicken from the infected area using the formats or the transportations like car. And then sometimes the aggregators will gather all the duck in their house, like a stocking pump, and they bring all the birds and the chickens through the permits to the live bird markets. So that's why the live bird markets one of the high risk factors because the virus as well as could be reassortment during the gathers in live bird markets. And then the live bird market who will have big retailers. I mean that I forget in English. Like they have big or huge sellers, not retail. So it's more dangerous because they will provide duck, birds, or chicken. So they will mix the virus in the one place. Then only for sell, like only for chicken only, for the ducks only. That's why the we say is very concerns to the mixed live bird markets. Okay, that's all for all the a bit information for this afternoon. I would like to thank you for this occasions. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Rico. Nice presentation as well. So we have the examples from students. The first presenter is Yosa. Yosa talk about stunting. We know that stunting is a national priority program in Indonesia. So in West Sumatra, we also have several districts that become priority area. So we also have Dr. Elvisa here, Professor Fight. He is the principal investigator and researcher about hunting, especially how to manage and how to use local products to tackle the stunting. So she was concerned about stunting and malnutrition issue is also happened in our system. So the second presenter, Aji, interesting presentation about how we associate the climate factors to results, and Aji also say about how mobility of population and impact to measles transmission. So, and our presenter is Mr. Rico, talk about outbreak of avian influenza in Indonesia. So there are several factors that contributed. The first is poultry density, human activities and movement, wild bird and native pond, paddy field ponds and wetlands, and live bird market. So I would like to open the discussion about the presentation the Ms. Yosa and Mr. Aji and Mr. Rico present previous. So, okay, anybody comments or thoughts or questions? Yes, Mr. Daniel.
Okay. Thank you, Mr. Giri. Sorry for the presentation, the presenter or anyone.
Yeah, it's up to you. You want to take a question to each presenter or have some thoughts or comments? So,
Okay. Thank you, Mr. Rudy. I have one question for each. Maybe first, Miss Josa, this is not about bread that you mentioned, I think, but I have one question. See, okay. From the results for the individual are not very 0.5. But I have given, I am bringing up the funding. It is full of reason. Yeah. There is a bit. This is the one, and then the second presenter, Mr. Aji, about methods. I have not from here's what you are doing, and how many things you want there. There's one, it's the one part of the things. So all you know that you use it. For Mr. Rico about AI, education and learner, is there any explanation why the curriculum learn well? There's where the education. Why about
Okay, thank you, Mr. Dayan. So, the presenters who will answer the questions or give a comment or thoughts. Maybe who first? Yeah, Andy, please.
Okay, I would like to answer to the question on why I'm not using the newest research about characteristic of those virus. So after conducting several research myself, I found that there haven't any mutation that lead into the survivability of this virus on temperature. So the for the last is it 60 no around around the 60 years there has any mutation on middle virus that at least that I found that has a link into the its survivability on temperature. So it the result is still the range from 15 to 56 degrees Celsius. There has any study that shows the mutation on its survivability against temperature. That's why I'm still using the reference from Nature magazine in 1964, and that offered by Dejong and
Okay, thank you.
Okay, the next one, Mr. Rico.
Okay, thank you. I mean that the effects among the animals or animals to humans. I mean the avian influenza could affect both of wildlife and the agriculture. The why the agriculture only affect or spread the avian influenza because we are very close to the agriculture like poultry or backyard farm. Maybe the backyard farm is I don't know. Yeah, that's why I say that this backyard farms and forest poultry they could find in everywhere. So that's why the agriculture is very common to insects to be with this like be with this birds or poultry ducks. Actually, the migratory birds will affect the agriculture's methods or spread the avian influenza to the agriculture's like focus about the proper So the enters the fund. And even though the electricity or the wire, it doesn't have any wires that created the line. So
Okay. So the main cause about this one is the management.
In commercial farms, right now, already decrease the case of the of the basic. The main problem is the major policies. Yes, I we agree with because major state management. So if the bigger policy of poultry have a good bias into this system, so this case or the other ways will decrease. So the fire and the is I think that it's sometimes there is like the virus doesn't have any contact with the quality of the nuts that you have like if you have a property proper like one not to visit or making maybe have I mean that you can control the case and
Okay.
Okay, the next question, yes, you sir.
So experience that is one of my friends. So we more than 0.05. So this study is about the analysis of sensory. So sensory that just only want to know the best formula from the formula 1, formula 2, and formula 3. So there is no difference on each formula. So we choose the best formula is formula 3. That the higher protein from the soybeans, wheat, and corn. So the protein from the corn or the or soybean can because and from the protein test or nutrition test, the bread can meet the need of the children at the time in the day. So for the supplementation. So that's the answer.
Okay, so Ryan, you have
Jadi,
comments.
yang
The principal investigator also.
for the question, yes, the direct answer, this addition, this study of the look how to make a product presentation for use to prepare the study. Yes, this research we have formula, the base formula, the formula contains this nutrition analysis, and there's content of micronutrient and protein. There's this nutrient, there's nutrient is nutrients improve the nutritional status for nutrition solution. There's in this we said we don't know this we don't to assess how to impact of the fermentation, not just for develop the best formula for fermentation. We use a red functional, and this nutrition as again to improve the nutrition and to prepare the state. And I think in agriculture, like different is population. How to best formula, how to make product or foods, best introduce to the mindset or subject for children or this the first this studies for we have the stage of studies. Stage 1 for develop or all the development also the base formula and base and or to stand try to the second
Thank you very much, Dr. Rizal. So anybody who have questions or comments? Last but not least, but maybe how we can try to give comments about the presentation or this. Yes. We would like website. We would like to ask the local plan to give comments about
Okay, good afternoon, everyone. Thank you for faculty and professors of the College for welcoming me here, and first to the class for inviting me here your presentations. Can you hear me here, right? Can you hear me here? I have to remain very okay. So, first, thank you and congratulations to all our three presenters. Everyone are good, and I'm hearing you for the first time, but I already understand what you presented. So, for me, that's congratulations. Maybe I'm just curious for my questions. This is just out of curiosity. So I think for Miss Yosa, good for you because your PI is here to support you. But yeah, seriously, of course, you have your project with your principal investigator or your professor, but do you know why you chose the red bean, the cartridge, etc. in your spider? What is the reason behind it? Because usually have like a reason why you use it. Not so many other resources. They see a lot of actual resources here and why you choose those ingredients. Aside from your professor asking you to use this. And then for my second question, like how many calories do you recommend per child for at least per day or enough per week to really address stunting? I think those are questions out of curiosity. And then for Yes, I answer first. Actually, just again, a question or curiosity, because even if you have a good vaccination for programs for newborn babies, children, mothers. So the MMR vaccines are important to this mission. I'm just curious if this is not very deep, but there's not very recent cases, but I think that happened in all developing countries where you look at there was yeah. So in Indonesia, what is the vaccination program like, particularly for MMR? At what point is it given? And like, are there any other vaccinations also required given to them? And then what is the second? Is there resistance also for mothers or parents in terms of vaccination, especially now that there's we had COVID-19 vaccinations just came out that a lot of parents or a lot of especially mothers that do not want to have their kids vaccinated just because there's very few information on vaccinations. What would be the case for Indonesia? And then like for the third one, just very quickly, I saw in your data, Dr. Rico, that you have you search on PubMed and MDPI articles. So is that like usual route to search for the articles? Is saying yes, because like I think yesterday or the other day I had a lecture on the predatory journals yesterday, and then of course an MBPI is a particular publisher, but if I may suggest you might want to like make a comprehensive search of your data or articles, and you can search for WOS. That's it's very important that these journals are SCI or SCI journals. There are medical journals, of course, like SPM. WOS could also be other index. So that's one, WOS. For the previous name, I think is Thomson Reuters. And then the second one is Scopus Index. So MDPI is both a Scopus Index and the WOS Index journal. And I am very glad that you are looking at MDPI because there's yesterday Dr. Lisa and I were discussing that there's this issue with MDPI saying that it is a predatory journal. So there's a fake just on that. You're not. So there's this fake site saying that the MDPI is a fake journal, but I'm very glad that you're still looking at MDPI. And we have like me personally, I have publication in MDPI. I review papers also in MDPI. So that's one. And then again, my second question is out of curiosity because you're a veterinarian. Have you heard of cage-free birds, and is it like good, or how does it compare with cage-free birds? Because you mentioned earlier that there are caged birds. Like, are cage-free birds good, or are they more susceptible to have the avian flu? Thank you so much.
Thank you very much, Professor Adi.
Okay, so to talk about the immunization. So there has been some doubt from parents, especially in Indonesia, especially in West Sumatra and Aceh. And these two provinces are the has the least vaccinated child in Indonesia. And for West Sumatra, the coverage for the immunization is only at around 57% after the pandemic. So there's no doubt that there will be some outbreak that happen in this region because let's imagine when the first wave of pandemic happened. Let's say the child is around 2 or 3 years old, and then 3 years later, that child is getting into school, and what the thing that we fear is that there could happen a cluster in that school. So maybe just one care of the child could bring the entire school into the hotspot of measles. And as for the COVID, for the UCI, because of the dog, there's so much. There the assumption of the parents that my child has been vaccinated before for the measles, BCG, and hepatitis, and many more. And the after the mandatory vaccination, the parents assumptions is why would my child getting vaccinated again? The- it's it's unnecessary to put more needles into my child. Yeah, that's the rough translation of what their assumptions are. So, and for the MMR, there are also the halal issue. So in around 2018, the Council of Ulama in Indonesia released a statement that MMR contain the unhalal substances. Yeah, that is why those two provinces. That's why few region in Indonesia um, decline the MMR vaccine.
Do you know what month what month what month is the immunization for it?
For the MMR is
Imunisasi dasar apa kan? Enggak ada MMR, belum MMR.
For in addition the for UCI for especially the measles is around 9 months. The baby 9 months. Yeah, 9 months old. Also, the for the government also like the crash program. The crash program is kind of like the how to enforce the vaccine on the child. So there's a program called Beyond, which is roughly translated as month of child vaccination. So all the child that hasn't taken haven't taken a shot, they have to take the MMR vaccine in that program. But the result is still varies across the region in Indonesia, and West Sumatra is still still in the lowest rate of beyond beyond acceptance in Indonesia. Mr. Rico?
It's the if you mentioned earlier that there are different cases when the birds are transported, but have you heard of the cage birds? Are they okay or minimize or increase the API, or do you have like also here?
Thank you for the question, madam. Actually, for the first questions, why I get DPI, honestly, because it's very easy to access. Yeah, it's free and fully accessed, and if we type the keywords, we could find specifics for the journals what we want. Sorry, so but I got from several journals and for my previously from my lectures from the university and some from my colleague that has written during in the several journals in our local photo journals. And the second one, honestly, for the free cage version or a free the case for the transportations. Honestly, until now, I never see the transportations without the cage. Uh, in the farms, they use actually they use a small cage. We call it transportation cage. Made from woodens or fragments. But they put maybe depend on weight. The weight. If they got 30 or 20 chickens or duck, they put all in the transportation cage, and then their weight, and they will move to the other area. It's kind of the systems during the after periods of the. I mean, after the like 1 month in for the meat, that is only for 30 days. After they rise specific weight like 1 kilograms, 1.2 or 1.5 kilograms. So they will collect all the chickens and put all in the cage or transportation cage like that, and they move to the other to the I mean to the slaughter house or the like markets. But nowadays, we have maybe I see the better cage made from plastic. Uh, but I think it's not proper right now. We don't. We could. I still now. Maybe for the transportation system, especially for the poultry, is not proper for the animal welfare. Actually, they transfer during the like heat during all day, not during the night, and no proper food, and put until the 5 or 6 cage vertically like that. Yeah, so covering during the transportations and the open, so uh, the fires might be spillover during the transportation, might be like that. If you want.
Thank you for sharing. Actually, as the Philippines, we are now into cage-free rearing in farms, in agricultural farms. So maybe professor can look at like if it's really healthy for cage-free versus those in cages, etc. Thank you.
For actually we have two like for made chickens or to the egg and there's like layer or made chicken layer for the layer chicken layer for the egg the meat for the meat consumptions for the layer they have battery systems cage for the actually for the meat they have a free range cage. Yeah, free range cage, but the problem is the transportation actually. Thank you.
Okay, thank you very much for Miss Yusa, Mr. Aji, and Mr. Rico. And sorry. Yes, please, Miss Yusa, sorry. So, yeah. you-
If you can go to that.
For the first question is why we choose beans, soybean, and corn. Uh, the reason first is because this food is local food and it's easy to find anywhere in this area. And this ingredient is high in protein. and protein nutrition can prevent the stunting for children. Maybe for the second question, how much have impact for the children? In this region, we have the guideline from Ministry Health. There is called AKG. This guideline contain how much energy, carbohydrate, protein, and fat we must consume in one day. For children, the snack is 140 for calories, and for the protein, 5 fat 5 gram, and for carbohydrate 20 gram. That will be right. That was very. One day. For meal time, snack time.
Okay, thank you, Miss Rosa, Aji, and Mr. Rico. So nice discussion we have here, and maybe it's we have actually I hope we have enough time to listen more five. So top five also have presentation for us, so we can learn and maybe some questions or comments or thoughts will be nice. Will be a nice discussion with top five later after the presentation. So allow me to give you a summary of Dr. Pairanjali Prita. She is currently university researcher, scientist, and also has 20 years of experience while performing research and teaching in the field of environmental microbiology. So she is from University of the Philippines. So yeah, I would like to present to you Professor Pai to give some presentation for us. So, Prof. Pai, the time is yours.
Maybe I can just like get up the number.
Ada? Udah. Wait.
Yeah.
All right, so I was going to and I think I really started to start when we are presented by was your space. And you're actually the here, but then you like thank you so much, Doctor. And perfect. I haven't, I have a lot of positions, but I was sharing. We perform both research and technical purposes in the field of biology. So this is just our vision and our vision we try to promote, produce, provide, protect, and perform. And then this would be our research thrusts. I know that some of you would be doing here food safety, security, sustainability, and even the medical aspects. So we are now into bioinformatics and predictive modeling and as well as other environmental monitoring and surveillance. So this is our lab. We have our webpage and social media sites. If you want to Google us or to see us clearly, you can contact us there. We have both a Facebook page and a website for the staff here. 30. I have 20 researchers and staff and more than 10 students in the lab. And also, same here, we have different campuses. I have students in the lab and there are also students in other campuses. So I go straight to the topic. It's actually biological determinants of health, but we realize there are also other majors here. So I tried the eco-biosocial determinants of health. This was one of the topics I think assigned to me by Prof. Randy, and he said to discuss the determinants of health. So I go straight to the One Health concept. I know you're public health majors, you're more than experts than me in discussing this One Health, so I just go quickly. Because I know we all have other schedules also. So what simply I wrote that there because I didn't have the translation in English, but this is in English, of course, you know that it is an integrated collaborative approach to balance and optimize the health of people, animals, and ecosystems. Of course, those would be the wider definitions. You know that by heart, right, as a public health major or expert. All of the graduate students are studying only or working also working. Only one, two, three, and the others are only studying. Wow. Half are working. In the working hours, I envy those who only study. When I think the graduate studies, I was all working, but there was a part of studying first. So I was straight to the biological determinants. It will just be some of the determinants mentioned in references. You know that of course, for human biological determinants of health, and we connect that of course to the ecological determinants of health related to bio. I go directly to the food and environment impacts on human health because that would be of interest to you both to the FP as well as to the nutrition researchers, but just let me know if not. So health threats from the human animal ecosystems interface are high. And zoonotic diseases or zoonoses, you know, of course, the different zoonotic diseases or zoonoses. And this would impose an increasing risk continuously to public health from those emerging pathogens transmitted through contact with animals, food, water, and contaminated environments. So this would just be in a nutshell telling us the ecosystem services being affected by direct drivers of change. So this would be the direct drivers of change. For those of you who attended earlier, I realized Mr. Diane attended the webinar earlier, right? And it's very, I remember your name asking the questions we discussed climate change. There are other drivers of change going to, of course, ecosystem services provisioning, regulating cultural and support. This would be just specific examples of the ecosystem services. You can go back to this. I think you can just share, guys, discussing this field. Professor Randy said, I have 15 minutes. I usually ask you, I will be discussing for 30 minutes, but it would take a long time, sometimes 1.5 hours. So I'll try my best to finish in 15 minutes. So this would be the environmental changes, loss of biodiversity, and ecosystem impairment. And this would be the health synthesis from the World Health Organization. I was asking earlier your members this. It would be very important as a public health expert to be looking at valid references in the World Health Organization and of course Food and Agriculture Organization, nutrition and shores. So just let me know if I'm going so fast. This would be estimating human pressure on the global environment, loss of speed, resources, land degradation, etc. And there could be examples of health impacts, the direct health impacts. These would be examples. Ecosystem-related health impacts such as flood fields, etc. I was part related of, we also have flooding. We also have in the Philippines, and then indirect deferred and displaced health impacts. So, what would be the health threats imposed by human animal ecosystems for the habitat? Or the zoonosis? We have, of course, the waterborne diseases in terms of biology through drinking water. You have it, I heard it earlier, you have HEPA immunization, HEPA virus, salmonella is a bacterium, cholera for Vibrio cholerae, amoebic dysentery, this is protozoan, Shigella, of course, is a bacterium, poliovirus, virus from third cell. Cryptosporidium and Georgia are protozoa. I have a subject on protozoa or immuno. Yeah. Okay. Then you have foodborne diseases also, are those transmitted through food, such as salmonella is a pathogenic organism with different serotypes, and those enteritis first will be pathogenic. E. coli, there are different E. coli, but not all are pathogenic. The BSE or bovine spongiform encephalopathy, the variant crystal Jacob disease or the mad cow disease. We also have it here in Padang. No, you're free. Yes, yes. So also there are vector-borne diseases such as the insects or arthropods. We have malaria, dengue, and we have here also. This very much discussed this morning during the webinar. And then airborne diseases, you know, this one of course, SARS-CoV, and the recent pandemic. And of course, the one that I call is a silent pandemics and antimicrobial resistance infections. You don't see them, but they're there. So this would just be a summary from 1918 from the Spanish flu. That is only up to 2013, but you can add one more, of course, for 2020, which is SARS-CoV. So I go straight on the food and environment on human health, which is ecological, public health, and paradigm of one health and one world concept. In the details and the collaboration the one health, but I just would like to share with you one important topic. It's very diverse topic. I would go straight to food safety. I know Professor here will be more interested in nutrition and food security. It's one of the, of course, the UN goals, sustainable development goals. And food safety, of course, is defined as handling, preparing, and storage foods, food products the best way possible to reduce the risk of contracting foodborne illnesses in all parts of the supply chain. So it is a joint effort starting with preparer and consumer to ensure the implementation of practices for food safety from pre, during, and post-harvest. So it's very simple. There's just 4 easy steps even from the World Health Organization, but we always protect, clean, separate, cook, and then shield. But if we don't do that, of course, there will be public health concerns. So how important it is worldwide? There's a World Food Safety Day as already given by the World Health Organization, starting in 2019 to be celebrated and to celebrated every June. It's very near. because it's already made. So the WHO uses this event to promote food safety to the public and reduce the number of illnesses that is caused by foodborne illnesses globally. So what would be the challenges in food safety? Already mentioned with different microorganisms called salmonella and of course Escherichia coli. And then of course in the Philippines there are foodborne diseases and outbreaks. There is also Ipalang, like foodborne outbreaks or not reported. Mhm. But they usually don't report sometimes. Like if you have diarrhea, mm,
It depends on the case.
the gravity of the case. If there are deaths,
Probably the symptoms or it happens in larger for example, in school or in
are usually a part of it.
so
It would be
it depends.
yeah, okay. So even in the Philippines, just last year, in the southern part of the Philippines, there was this outbreak with 300 cases and 7 deaths. So this would be due to agricultural symptoms. So I go straight to because my major is in microbiology. So what is food safety in microbiology? There could be either the positive or the negative effects. So it could either be contamination or of course the positive side, the fermentation. You realize, you understand, you identify the other products, right? It is due to food microbiology. And then this would just be technique. I will not be discussing this in detail, just techniques in microbiology and how to study. I believe Professor also said that and probably do this also. And just to satisfy the title earlier, eco-biosocial. So I'll try to discuss the social determinants, although I'm not an expert on social factors, maybe you are. So income and social protection, education, unemployment and job insecurity or security, working life conditions, food insecurity/security, housing, basic amenities, environment, early childhood development, social inclusion, and non-discrimination, social conflict, and access to affordable health services of decent quality. This is just a summary of from the World Health Organization of the examples that I mentioned earlier. So, but anyway, aside from the eco-biosocial, that would be the title assigned, I understand that there is now increasing like direction towards behavioral determinants of health. So aside from the eco, bio, and social, I assume you also believe that there are behavioral determinants of health. Also, of course, now there is what you call as a mental health aside from the physical health. So first, this would all be examples of the behavioral determinants. So, and aside from that, the eco-biosocial and the behavioral determinants, have you heard of the planetary? Yes, yes, there is an increasing interest into another field, and we call it as planetary health. It is the health of the human civilization and the natural systems on which it depends. So it is not only the health of the community or the people living in the community or the organisms, the animals, plants living in the community, but it's the health of the planet in general, so human and planet. So it's an increasing interest in this field, and we call it as planetary health. There's one in the Philippines. I'm not sure if there's also a movement in Indonesia in terms of planetary. Can involve you later on. This is like an emerging field. All right, so I just would like to summarize the determinants of health in biological, social, physical environment, as well as the behavioral determinants. This we have already everything we have discussed earlier, and not be enumerating them one by one anymore. But anyway, just because I just wanted to share that because I end my presentation there. I asked earlier if half of you are working already and half are students. So just because it is my first time here in Padang, and thank you of course for inviting me here in class. I just would like to share with you what you can become after finishing your public health major. And this is I had this interest because I asked the undergraduate students the other day what they want to become. I was surprised that no one wants to become part of the academy. But I see your great professors here that they are like concentrated into the academy. So just let me share with you what you can become. You can become, of course, a teacher. And I'm very biased. So I put that first always. Be part of the active team, be part of us, be part of research, and become a scientist. I'm sharing this because this is the facade for administration building. This is the sunflowers that bloom along the university avenue to signal graduation. So next month it will be graduation, right? There will be sunflowers. It will either make you happy or sad. Because if you're graduating, of course, you will be happy to see the sunflowers. I hope you can visit us and of course see the sun, not only the sunflowers, but also me and our institute. Of course, be a researcher. Aside from being part of the academy, I understand the professors, all of us would teach plus of course do research and do scientific research. So research, the field of science brought me to places, and this is one of the reasons why I am here, a researcher of science and also teach. So I hope, yeah, one of you will become part of it. And of course, be a scientist and be ahead of the lab. If you're not ahead of the lab, just be part of the lab. And of course, a fellow. I'm sharing this one. I am here because I met Dr. Maki as an ASEAN S&P fellow. He's my senior. He's ahead of me just by one batch. And I think he was 2018, I was 2019, 2020. And this is ASEAN S&P fellowship. I'm sharing this one because this is under the ASEAN Foundation and ASEAN Secretariat in Jakarta. Here in Indonesia. So you have there are a lot of opportunities. Like right now, they have ABSC, the ASEAN something. So you can check their website and they like support graduate students like you. And of course, because of that, I was able to go to different services and even attend the ASEAN COSTI, Committee on Science and Technology in Bali, Indonesia. That's why I went there. I was being asked every time where I went already in Indonesia. It's my first time in Padang, but I already went to Bali because of this one. Jakarta, Surabaya, and Yogyakarta. And then, of course, you can be Professor Awal is an influencer, but as a scientist or a researcher. And Professor Aman also, I think, is an influencer. So you can be an influencer or a mentor also to science. Yeah, a singer, yes. Aside from being a singer, of course, you can be an influencer in terms of your field of interest, aside from being a singer. And of course, a part of a professional organization. So just an advertisement, if you're of course, you're a graduate student. I am an early to mid-career ambassador of the International Society for Microbial Ecology. There will be an international conference soon, so please stay tuned in the website for updates. Or if you can join because I know you have different topics related to this one. So it's International Society for Microbial Ecology. Then we also have other societies in the Philippines. Probably if you have microbiology related work or any health related work, I hope we can invite you or your professors. I am also part of the director of the Philippine Society for Microbiology, the Philippine Ecological Society, and the Prize Biological Sciences Honor Society, and the Philippine Association of Career Science. So those are my affiliations. And I hope that like any of you or even one of you could continue to communicate with me or be part of. Thank you very much. I have 15 minutes for yeah.
Great, thank you. So from my solid presentation from Professor Pai. So we have time to discussion. So anybody to comment, please, Dr. Helmiza.
Yeah. Okay, thank you very much for fine. Nice to meet you. Let me introduce myself. My name is Hamida. I'm sorry to your webinar before I can attend your webinar because I'm meeting you tonight. Then I think this interesting and very thanks for your coming for our faculty. And maybe I introduce yeah several my background and my research, and I'm especially in nutrition. But I'm interested about 3 years. My topic research about maybe relevant with my with nutrition about probiotic and this. Yeah, can we use yeah we develop and we investigation of how they contains probiotic in the diet in West Africa called diet. It's like dairy foods from buffalo milk, and it contains more microbiology contents. And we used to some the product from the diet we used to prevent stunting or the food fermentation for pregnant women and others. And I think it is interesting you about your topic about microbiology. And my question is, it is a change or our collaboration in my master's student. Let's topic about how to investigation the contents of microbiology in some product from dairy or dairy foods, and then we will to it's maybe the topic of research, the will to investigation or the to determine or antioxidant activity and the contents how the species of probiotic in the samples. And we would like you to can introduce me that your laboratory can be collaboration to the master student can use the laboratory and the research here. Okay, thank you very much.
Thank you so much, Professor. I get excited because I also have like research. We can talk more later into the exchange information. And then also in a faculty meeting we discussed like the official like we have to process officially the memorandum of agreement or understanding first officially graduate. And also there are programs in our university on how to do exchanges, so like the world expert lecture series where we can invite experts from your university. Thank you.
Lagi MOU dari kerjasama itu sedang